Okay, so cranial nerve 1 is the olfactory nerve. So you ask the patient whether they have any issues with their sense of smell, so their normal perfume or aftershave, coffee, chocolate. That's all fine, then we're good. If we do want to test it, you can get a cheap way of doing it is just get a container, put some coffee in it, get the patient to put one finger on one nostril, and you would hold it under the nostril with their eyes closed and say, "What is that smell?" and do the other side. Second one is the optic nerve. So we will be testing visual fields and visual acuity. So acuity, we can just say, we're just using something here like a Snellen chart, something like that. This isn't a Snellen chart. And just read the top line there. Can you see that okay? And as long as it can, then we're okay. So for visual fields, all you do is you're going to get the patient to cover one eye, and you will cover yours. And then you'll say, you can use fingers to do it and just do quadrants. So you can say, how many fingers am I holding up? And then you can do all the different areas of the field. Ocular motor, which is cranial nerve 3. If you keep your nose, looking at my nose first of all, and then just follow my fingers with your eyes. So you're forming a H, and we're just making sure there's no catch-up saccades or anything like that. We can also do pupil dilation. Just look into one pupil to make sure that it constricts, and that's the direct one. But then when you do it on the right, you should also notice it on the left as well. So you would look to make sure it's constricting, and then going back to normal and back to normal. Okay, there we go. Thank you, Ness. So when you're doing the H, we are testing cranial nerves generally 3, 4, and 6 together. The other one is the trigeminal nerve. So cranial nerve 5, we're going to be doing sensations. So we can use either a piece of tissue and just making sure that feels the same. Don't do the hair. We can do sharp and blunt if we want in the same areas. The other thing we can do as well is do resistance. So basically just push your chin into my hand and this side, just to make sure that everything's nice and strong. You can also as well get them to bite down gently and just bite down for me. And you feel the temporalis and relax and bite again, and the masseter. And that's testing cranial nerve 5. We've already done 3, 4, and 6. 7 is the facial nerve. So Ness will love this one. So I want you to close your eyes, squint them up, and I want you to open them wide, smile, just that's it, and then blow your cheeks out. And that's a nice way of screening there. We also look for the facial nerve for sensation if we need to, for the anterior 2/3 of the tongue, and that can sometimes be an issue. Cranial nerve 8 is the vestibular cochlear nerve. So we are looking at hearing and balance sensation. So hearing, you can just whisper a number in their ear, and then I just want to say what I'm whispering. 10. Okay, or you can say, can you hear me doing that? Tell me when you can't hear it. Cranial nerve 9 is the glossopharyngeal nerve. So you can do that by getting them to swallow. So if they had a glass of water, just checking that. 10 is the vagus nerve. So we can be looking for changes to the voice, so hoarseness. We can also get them to do the ah side. And just what I want you to do is put your tongue on ah. Open it wide. There you go. And what we're looking at is to make sure there's no deviation of the uvula and the palate raises symmetrically on both sides. Number 11 is accessory nerve. So you can do that by resisting rotation. So just turn into my hand, elevate your shoulder. And finally, cranial nerve 12 is the hypoglossal. And all you do here is stick your tongue out, and you make sure there's no fasciculations and the tongue's not deviating to either side. So that's a very quick run through of the cranial nerves.